To the coronavirus tonight, more than 115,000 Americans are hospitalized because of COVID-19. It is a higher number than we have ever seen before. But as we look deeper at those figures from the COVID tracking project, many states in the center of the country are seeing falling hospitalization rates, particularly in the Midwest. So we've got this color-coded map. Take a good look at your screen. The red means hospitalizations are rising. Those cream colors mean staying the same, and the gold colors, which you see primarily in the Midwest, those states are seeing falling numbers of hospitalizations. We are joined tonight by Doctor from the Midwest. Dr. Jeff Pothoff is the Chief Quality Officer at the University of Wisconsin Health Center in Madison. Doctor, as always, thank you for your time. We appreciate you coming back. First of all, talk to us about what you are seeing in Wisconsin right now in terms of cases and hospitalizations.
I have to admit, we were a little bit surprised. We expected our surge to continue post-Thanksgiving, but we didn't see that post-Thanksgiving surge. We saw a decrease in cases, and then, as you would expect, a decrease in hospitalizations. So things are better. They're not yet good, but our numbers look much better today than they did just a few weeks ago.
To what do you attribute that change?
You know, we've come up with all kinds of theories around it. You know, the only thing we think that holds water is when COVID-19 just tears through a community, people are much more likely to have firsthand experience with it. And just like some of us learned that the stove is hot because our parents told us, some of us had to touch the stove. And I think when COVID-19 touches you or someone that you know, it's a very strong motivator of behavior. And I think it encouraged a lot of individuals to start masking, socially distancing, doing the things that we've been asking them to do because they had firsthand experience with COVID.
Well, we certainly don't want people to put their guard down when they hear that case numbers in your state in particular are going down. What we're seeing in California is very alarming, 2 million cases at this point, and their hospitals are concerned about capacity and also equipment. As we move into the Christmas holiday and people do have plans to gather, what are your concerns about hospital capacity in your area and a potential another rise in cases?
We have some particular concerns. So, you know, one concern is that we have had some good news. And I think when you have good news, like cases decreasing, hospitalizations decreasing, they're seeing frontline healthcare workers get the vaccine. I think there's a tendency to think that this pandemic is over, that we are, you know, end of game, time has run out, we can get back to normal. And that's just not the case. If we see large gatherings here in the Midwest over the Christmas break, over New Year's, we'll be right back to where we were before Thanksgiving, with hospitals on the brink of not being able to provide essential medical care to those people who need it most. So a really important message to people is we need to stay home for this Christmas. We have to make it through this holiday. You know, the sun is coming. The end of the pandemic is near. The vaccines are going to be a real game changer, but we're not quite there yet.
Let's talk about the vaccine. I'm curious how the process is going in Wisconsin and in your health facility with distribution and also administering the vaccine.
You can imagine logistically, it's quite the process, but we knew months ahead of time that we would be getting vaccine, and we put the wheels in motion. And when we got the vaccine, it was last Monday, we were ready to inject the same day. I think we're now injecting frontline healthcare workers at the rate of approximately 500 per day. Other health systems in town are doing the same, you know, and as long as the supply keeps up with what we need, I do think we can see pretty rapid dissemination of this vaccine, at least in this area.
Have you received the vaccine yourself?
I did. I got it last Friday.
And how are you feeling?
I felt great. You know, we talked a lot about side effects. We were worried about people calling in sick because the side effects are going to be so severe. It really was nothing. I didn't even need to take Tylenol or ibuprofen.
Before I let you go, Doctor, real quick, we have about 30 seconds. Your thoughts on this other kind of mutation of the virus, this more contagious strain that we're seeing in the UK right now?
Yes, this is expected of this virus. Viruses are known to mutate, especially coronaviruses, and this is how they get better. This is natural selection. You know, viruses that are more contagious tend to win out against, you know, other mutations that make them less contagious. Now, there's a couple things that are good about this virus right now. One, the mutation doesn't make it more virulent or more likely to cause severe disease. The other thing is it hasn't changed enough to make the vaccines ineffective. So we're still pretty confident, very confident, that the vaccines that are available will work just as effectively against this mutated strain versus the other strains we've seen.
Dr. Jeff Pothoff, the Chief Quality Officer at the University of Wisconsin Health in Madison. As always, appreciate your time. Thank you very much.
Thank you.